Do you feel tired, sleepy, or bloated after eating? That's not normal. Those are early signs of insulin resistance. Let's take this bit by bit. Insulin resistance might sound vague to some people, but let's simplify it in a way that you can understand and get empowered to thrive health-wise. Sugar in the form of glucose is the fuel that powers your cells to carry out their biological function. I'm able to move my hands because my hands have enough supply of glucose. I'm able to see without having blurry vision because my eyes is getting just the exact amount of glucose it requires to function properly. Now, insulin is the hormone that delivers this sugar to your cells. Insulin acts like the delivery van that conveys this sugar from your blood to your cells where they are utilized to function. Now, there is another thing you need to know. Another important biological weapon you need to know about that also partakes in making sure that your cells are well powered. That's the mitochondria. The mitochondria is the powerhouse of your cell and is the factory where this sugar gets turned into fuel that your cells utilizes to function. Now, insulin resistance happens when your cells begin to resist the binding of insulin. Don't get it twisted. Every cell have insulin receptors. The same way your keys have key receptors, the same way your padlock have key receptors, your cells have insulin receptors. And what happens is that insulin binds to these receptors. The same way your key attaches to the lock is how insulin binds to the cell. When insulin binds to your cell, what happens? It unlocks the cell. And when it unlocks the cell, glucose goes into the cell. Alright? When insulin unlocks the cell, it delivers glucose right into your cell. But in cases of insulin resistance, due to a change in the structure of the lock, for so many reasons, so many factors can change the structure of this lock, or blockage of the lock, the cells begin to resist the binding of insulin. The cells begin to resist the binding of insulin. Insulin will try to bind to the cell will resist it. And the brain, sensing that resistance, will trigger the pancreas to release more insulin. And this excess insulin might be able to overcome the resistance and sneak in some sugar into the cell. But steady sugar spike causes steady insulin spike. Insulin spike does not happen in isolation. It comes with some other health consequences: polycystic ovarian syndrome, erectile dysfunction, fatty liver in the form of belly fat, high cholesterol, prediabetes, diabetes, and the rest of them. If you want to learn how to reverse insulin resistance, diabetes, or prediabetes, follow for more.